Hi viewers, today I'm going to talk again about migraine care, and today specifically going to address a question I get in the clinic from time to time, and that has to do with how to choose your migraine treatment. Chances are that as a migraine sufferer or regular headache sufferer, you are having at least one or two medications in your repertoire of medications for migraine. So, how do you choose the right one for each attack of headache? That's what I'll be addressing today. But before I dive into the video, you might be seeing a beautiful background behind me. So I just told it to use it, and it's because for October is the month where we, you know, do breast cancer awareness in the hospitals. So encourage all the women around you to get tested, get screened for breast cancer, because this cancer really, affects a lot of women, and the earlier it's detected, the better the outcomes. So back to the video. So like today, I got a patient who phoned in, and this patient had been on a medication called triptizol, which is supposed to be a preventative medication. So, and she was having a terrible headache and phoned in to ask me if she could take an extra dose of that to help to resolve the headache she was having. And I thought I had done a very good job, a decent job in the clinic, trying to educate her about what this medication was meant for, how and when to use it. But she was still confused. So it looks to me like we would need to do more work in this arena. And that's the reason for doing this video, to kind of enlighten you about the different types of medications available for migraine. So, there are two possible types of medications you could have, no matter what the name is, in whatever part of the world you are in. Whatever medications you have for migraine, they can all be separated into two departments or two categories. One is the category of preventatives, which are medications that you take regularly, whether or not you have a headache ongoing. These medications help you prevent migraine. They help you lower the chances of getting migraine attacks. So these work on the very biology underlying migraine, and they make your migraine less powerful, less potent, less troublesome, and therefore your headaches become less frequent. And even when they happen, they become less intense and more responsive to your rescue medications. And that leads me to the second category of medications, which we call the rescue medications. So these rescue medications are the medications that you take and you're having a headache now. So you would have no business taking those medicines if you don't have an ongoing headache. So these medications will help rescue you. And these medications do not necessarily cross in their effect. And what that implies is, if I am having a headache right now and I decide to take my preventative, it would not necessarily resolve the headache. So it has its own place to work in the background to kind of you know, gradually make my migraine less powerful and decrease the migraine activity in the brain, and therefore reducing the chances of getting headaches. But when I get a headache, I would need to take my rescue medication. And rescue medications, if taken every day, would not necessarily prevent headaches. So these two never made it like parallel medications, even though nowadays there are new technologies kind of trying to dissolve the line between the two of them, but we wouldn't go into that today. So you need to ask your doctor the medication you're taking, whether it's a preventative or a rescue medication, so you can know when and how to take them. Now, medications like triptizol, like Inderal, like Topamax, they're all preventatives. And I do not consider that patient of mine who was on triptizol and called in today to ask if she could take an extra dose for rescue. I do not consider her question as being idiotic at all, even though I did a good job trying to educate her in the clinic about this medication. So I still saw that there was some sort of confusion. And I've seen this before, and that's why I do not think it's a stupid question. So I've seen patients who were using preventative medications as rescue medications, and therefore it had no effect. And they concluded that their medications weren't working when they came for consultation. And the real problem was kind of, mixing things up. It's just like what we do in asthma care. I'm not a pulmonologist, but from my basic internal medicine, I understand that we've got two kinds of treatments for asthma. We've got, the rescue therapy, and we've got the preventative therapy, and they don't necessarily cross. So the rescue therapy is what you use when you're getting an asthma attack to relieve the symptoms, and then the preventative medications or controller medications that the ones you take, regularly to keep the asthma activity down. So it's the same concept. You can, translate to headache care. So the crux or the main point of this presentation today is to, ginger you towards thinking in this direction, whatever medicines you're taking for migraine, to asking your doctor to help you sort out which ones are the preventatives and which ones are the rescue medications, and then you know when and how to use them. So I do hope you enjoyed the video today. If you did, I'd like you to comment, share, and don't forget to subscribe. So I hope to see you again in my next video. Bye for now.